guys ready? Good morning, everybody. It's pleasing to be out at Kudos Bank Arena today, a vaccination hub where over 210,000 people have been vaccinated in New South Wales. And pleasingly today, our state hits the milestone of 80% first dose vaccination. An incredible milestone given the journey we've all been on, and I can't thank the community enough for responding in such a positive way for our calls to get vaccinated. In terms of double dose, we're up to 47.5% of our adult population being completely vaccinated, and of course it's that number we're looking to allow us to have those freedoms at 70% double dose. So we're at 47.5%. and inching ever so closely to that 70% double dose figure. But to reach our first dose of 80% is a huge tribute to everybody in the community, and some of our communities in Western and Southwestern Sydney have vaccination rates closer to 90%. Just an outstanding result compared to where we've been and where we are today. Pleasingly, we know that if this trend continues, once we open up at 70% double dose, that first dose rate will be high enough for us to feel confidence that we won't overwhelm the hospital system and that we'll enjoy those freedoms as we're all looking forward to. Regrettably, community transmission had 1,259 cases yesterday, and 12 people lost their lives, and we extend our deepest condolences to the families of those loved ones. But I also say to keep your family safe, please follow the health orders. Don't give up, don't be complacent. We know it's been a stretch, we know it's been a struggle, but there's only a few weeks left, really, before we get to that 70% double dose. And in particular, I do want to thank all those communities of Western and Southwestern Sydney. Minister Lee is here from the seat of Parramatta, representing one of the communities of concern. And as a community leader, he understands as much as anybody else what it's like and what it's been like for families in the last little while. Pleasingly, after receiving advice from both police and health, given we've hit that 80% milestone across the state, we're able to lift the curfew in those areas of concern from tonight. And I want to thank the police commissioner, and also the health teams for giving us that advice. This is a whole of government decision based on a number of factors, but I want to send this strong message. We can't move on anything else just now. We need everybody to hold the line. Please make sure that if you do live in those local government areas of concern, that you'll stick to every other rule that's in place. We've seen a stabilisation in the last few days, and we don't want to see that trend go the wrong way. We still have work to do. We can all see the light at the end of the tunnel, but we still have work to do. And I just ask everybody, especially in those local government areas of concern, to hold the line and to make sure you follow all the other rules that are in place, and make sure that you support each other during this time. And of course, we're there to support you as well. I also have with us today Dr. Bereijiklian. She's the birth unit director from Liverpool Hospital. We know there have been some concerns about vaccinations and pregnancy, and Dr. Bereijiklian will answer those issues today and give everybody a degree of confidence about vaccinations and issues regarding pregnancy and birth. Again, can I thank the people of New South Wales for listening to our calls. Dr. Chant and I and Minister Hazzard and the whole team look forward to seeing that 80% number incrementally go up, because once we open at 70% double dose, we will have more confidence that the community is safe when that first dose rate is as high as it can be. And we also know by that time that we'll have a number of 12 to 15-year-olds vaccinated as well, to give us those extra layers of confidence. But I also want to make very clear that all of us should look forward to what we can get once we hit that 70% double dose. And as the roadmap that we released indicated, at 70% double dose, you will be required under the health orders to only be able to frequent venues if you're vaccinated. And I just want to make that very clear. It's black and white. If you're not vaccinated, you can't go to a restaurant, you can't go to a cafe. At 70% double dose, everybody, every business leader, every community member should be very clear that the health orders will be saying that you cannot go and do anything on the roadmap which will be specified unless you are completely vaccinated. Dr. Chant will now give her health update, and then Dr. Bereijiklian from Liverpool Hospital will give us her update in relation to women and pregnancy and vaccination. Thank you.
There were 1,259 locally acquired cases of COVID reported in New South Wales to 24 hours to 8 p.m. last night, and 2 overseas reported cases. There are around 234 cases in ICU, and they vary across all age groups, reflecting the fact that COVID is a severe disease for all. Of the people in ICU, we have 234 and 185 people are not vaccinated. Again, this is not to call out those that are vaccinated from those that are unvaccinated, but it is to reassure the community that vaccines are effective, and it is important that everyone takes this opportunity with increasing supplies, particularly through general practice and pharmacy, to get vaccinated. Sadly, we have had the death of 12 people, and my condolences to their families, 7 women and 5 men. These people were a range of ages, reflecting the severe impact this disease can have on all members of our community. There was a woman aged in her 30s from southwestern Sydney, died at Royal North Shore Hospital, and she had underlying health conditions. We're also reporting the deaths of 2 people in their 50s, 3 people in their 60s, 3 people in their 70s, 2 people in their 80s, and 1 person in their 90s. Of the 12 people who sadly passed away with COVID-19, 10 people were not vaccinated, 1 person had received 1 dose of COVID vaccine, and 1 person had received 2 doses. This was the gentleman in his 90s with underlying health condition who died at the Westmead Hospital, and he acquired his infection at the Hardy Guildford Aged Care Facility. In terms of sewage surveillance, we have found our sewage surveillance incredibly reliable in giving us the early warnings in relation to cases. And we have had sewage detections in young. And I can report today that we have identified a person who spent time whilst infectious in Wagga Wagga, Young and Mudgee. I call upon all of those communities to be vigilant for symptoms, and our website, New South Wales Health website, will be updated with contact and exposure venues. But it is very important, given we have had those sewage detections in young. We have now confirmed that through that testing increase in that site, that we've identified a person who has been infectious in that community. In terms of the overall pattern of the disease, we are seeing pleasingly some stabilisation in the local government areas of concern, and some downturn in some of the local government areas. I can't re-emphasise the Premier's comments. We need to continue to adhere to the public health orders. We need to stay with it. We have to make sure that we drive home the declines we're seeing, so that we get to the lowest possible level of community transmission of COVID. We need to push those vaccine coverage levels. So I'm internally grateful to the residents of southwestern and western Sydney who have presented for vaccination. But I urge you to be one of the most highly vaccinated populations in the state. So yes, you've achieved 80% in some of your local government areas. Yes, you've achieved 90% in some. I'm challenging you to even push further. So please come out and get vaccinated, and get that first dose and get that second dose as soon as possible. Thank you.
Good morning. My name is Dr. Gauthami Bagunani. I'm the Birthing Unit Director at Liverpool Hospital, which is one of the COVID referral centres in the southwest. I'm an obstetrician, and I've been caring for pregnant women throughout this pandemic, including women who have been very unwell from the COVID-19 infection. I'm here today to encourage all women who are planning pregnancy, who are currently pregnant, and those who are breastfeeding to please get their COVID vaccines. Currently, the 2 vaccines that are recommended for pregnant women are those from Pfizer, which is already available, and the one from Maternal, which will be available soon. Outside of pregnancy, all of the vaccines are safe, and this includes AstraZeneca, and you can have this if you are planning a pregnancy or breastfeeding. The concept of vaccination for women in pregnancy is not new. For many years, we have routinely vaccinated women against influenza and whooping cough. I understand the concept of COVID vaccination can be concerning to some, and it seems we have approved and implemented the vaccine very quickly. but the technology behind the development of the vaccine has been around for about 10 years. Many women are worried that the side effects of the vaccine in pregnancy have not been researched enough. But I want to reassure everyone that the safety profile of the vaccines in pregnancy has been studied extensively. In Australia, we have had the added advantage of seeing the effects of the vaccine in pregnant women overseas. Over 100,000 women were included in studies from the US and the UK. These have not demonstrated any adverse outcomes for your baby. The vaccine does not increase the risk of miscarriage or structural abnormalities for your baby. It does not affect your fertility. What poses the greatest risk to women and their babies is not the vaccine, but it is the COVID-19 infection itself. Having COVID-19 whilst you're pregnant means that you are at double the risk of needing an ICU admission, you have an increased risk of needing invasive ventilation, and you're at increased risk of requiring a preterm delivery. It also doubles your risk of stillbirth. Most of the women who have been admitted at our hospital are unvaccinated, and none of them have been fully vaccinated. By receiving the COVID-19 vaccine in pregnancy or when you are breastfeeding, not only are you protecting yourself, but also your baby and the rest of your family at home. The antibodies that you produce after having the vaccination can be passed on to your baby and can then offer some protection to your baby as well. The Delta variant of COVID-19 has been seen to be particularly contagious within households. By receiving the vaccine, you will also help prevent the transmission of COVID-19 to your other children and to other members of your family. Likewise, other members of your family, including the support person who is coming with you at the time of delivery, need to be vaccinated in order to protect you and your baby. It has been heartbreaking to see women and their families being separated due to COVID. It has been heartbreaking to deliver babies preterm because their moms have been so unwell. It has been heartbreaking to separate the babies from their mothers and fathers because they need admission to the nursery and their parents have been too unwell to visit them. I am a new mom myself. Most of us spend a lot of time in ensuring that we are eating the right things, exercising, doing all the things that we can in order to provide our babies with the best start in life. Getting the COVID-19 vaccine is the best thing that you can do to protect your baby in this climate. Thank you.
The curfews are now gone in those hotspot areas. What stopped you today from going a step further and further easing those restrictions in the 12 LGAs?
Well, every decision we take is based on health advice, and if it's related to compliance, also input from and advice from the police commissioner and other government agencies. And as Dr. Chand and I have both said today, we still have a lot of work to do. We still had 1,259 cases overnight. The stabilisation and decline in some areas of concern is pleasing. And we are at a critical stage. We always were shown the modelling which suggested we'd reach our peak sometime in mid-September. Now, we don't know where we are on that peak, but what we do know is we want to see the continued stabilisation and the case numbers coming down over time. And that is why we have to hold the line. We know every day, Minister Hazzard and myself and other colleagues, including Minister Lee and other colleagues, every day we ask the health team to scrutinise the restrictions we have in place, to see whether areas can be taken out, to see whether there's any opportunity for us to relieve. And when and if there is, of course we will do that. But the best advice we have that it's too early and too risky to do anything further today. But as a token of our appreciation for the fact that we reached that 80% milestone, given the feedback from police who suggest that compliance is improving in many areas where perhaps previously it was not, plus the health advice about mental health challenges and the risks of not providing people a little bit of relief, all of that was balanced up. And has been balanced up over some time. We review those restrictions, we review what we're imposing on the community, matched against the data every single day. And it's just not feasible at this time, ahead of any further health advice, to move on anything else. And please remember that even in a community we have roughly 2.2 million people in those areas of concern. even having 20% of them not vaccinated is about 400,000 people. That's a lot of people when the virus is still circulating in high numbers. So we have to be aware of that at all times. And again, I'm not about being in a popularity contest. I'm here to do my job. My job is to keep the community safe and to relieve the pressure on our health system. We know that October is likely to be the worst month when we have admissions into our hospitals and into our intensive care units. And as Dr. Bagnani has said, she sees the distressing situation when families are confronted with COVID, especially in new families, in new parents, and the distress that causes. So we want as few families as possible to go through that distress. We also want to protect everybody who's protecting us in our frontline health system. So during the pandemic, during the next couple of months, and the next couple of months will be the most pleasing in terms of getting out of the lockdown, but also the most challenging, where we will have to balance every day the risks between putting pressure on the hospital system, but also allowing people to live freely and allowing businesses to start up again. And that's the challenges we're faced with. But we've been very open about that, and we're up to those challenges. We're looking forward to getting to that 70%. And given how our vaccination rate is going, we're feeling more and more confident that the dates we'd previously assumed we might hit that double dose figure could actually be earlier. And that's up to all of us. If you're due to have your second jab, please get it. It will mean all of us can enjoy freedoms that little bit sooner if possible.
There are growing calls from Liberal MPs to lift some suburbs.
I'm sorry?
There are growing calls from Liberal MPs to lift some suburbs out of the areas of concern. How are you going to respond to those calls?
Well, we respond. It's many people from the community who want us to consider every day how we can ease their burden. And I want to thank everybody who's been doing the right thing. Those of you who've been doing the right thing are the ones that suffer the most, but the ones who keep the community safe. And it's a whole host of people, of course. I don't think there is a single person in New South Wales, whether you're in lockdown in those areas of concern or outside those areas of concern, I don't think there's a single person that doesn't want to have more freedom than what we have today. But we have to do it cautiously and responsibly, and to make sure we don't compromise the great results we've had to date. And when I say great results, I mean preventing thousands of deaths and thousands more hospitalisations than what we already have, but also easing our community through the transition. As I said, every state, every country on the planet has to go through this. It's never easy. It was never intended to be easy. We are holding up very well compared to other parts of the world, but we still have a bit to go. And as that 70% double dose figure comes closer and closer, I think people will feel more hopeful and optimistic. But it would be a shame, after all the difficult strides we've been through, to give up at the last minute and ease things too soon, which will compromise all of us having those freedoms once we get to 70, all of us who are vaccinated, I should say, having those freedoms at 70% double dose.
All those LGA concerns, some of them are far exceeding that 90%. Where's lagging behind, and what concerted efforts are being made to bring those vaccine rates up before we do reopen to vaccinate?
I've talked about that topic quite a few times, but we have a daily information where every single person can look up their local government area, their suburb, to see how the vaccination rates are going. So, of course, some communities are doing exceedingly well, others are doing less well, but that is because of a number of things. And some communities haven't been obviously offered Pfizer in the same way, young people in particular, than other communities. So we're trying to make sure we meet those supply issues as much as we can, and we're grateful the Commonwealth has given us those extra doses some weeks ago, but it's a combination of issues. We also know there is obviously pockets of resistance. They're not large though. They're identified in certain locations, and obviously in vulnerable communities we're making sure we have those outreach programs. And we had obviously Nurse Austin here the other day from St Vincent's talking about her outreach vaccination vans, which go out to vaccinate those who can't come to one of our hubs. So we have a number of ways in which we're reaching communities that don't have those vaccination rates as high as we would like, and especially in rural and regional communities we've had a very proactive position where if we know a town is under the state average, we've had a pop-in vaccination clinic over a weekend, and then suddenly that town becomes above average. So we're addressing all those issues now. We're keen to make sure that everybody who wants the vaccine has access to it ahead of us opening up, because it would be very difficult for someone to say, hang on, I've been trying to get the vaccine and I haven't been able to, and then they be excluded from all the things that others enjoy.
How can
when the floodgates open in just a few short weeks to that community, some doctors are saying we need to ring-fence some zones until they catch up to the state average.
Well, obviously, some communities like Byron have a larger percentage of people who choose not to be vaccinated. That's their choice, but they won't be able to participate in the activities vaccinated people will. And as we get closer to that time, Dr. Chant and the Health Department will give government advice on how we deal with those communities, but also more broadly, how we deal with communities that might have high rates of disease still in them at the time. And as I foreshadowed the day we announced and released the roadmap, it could be a situation where if case numbers are too high when we open up the state, that if you live in a community or in a category of person who has those high rates of the virus, we might have to say to you, for the next little while, do all those things that you're allowed to do, but do them within your local area. So we have all those options, and of course, as we get closer to that time, Health will be able to provide us with their advice. But there's no doubt that we do look at the two issues we look at are the high vaccination or the vaccination rates, but also the prevalence of disease. So obviously, in parts of rural and regional New South Wales, it's much easier to isolate communities or to at least provide direction for communities because there's a distinction between townships. It's much more difficult in urbanised areas, and that's why we look forward to getting the health advice as we do. We get it every day, but obviously as we get closer to that 70% double dose figure, we'll be able to give the community greater advice and information, but all of us will be able to follow the numbers on a daily basis anyway. And again, the two most important numbers are the vaccination rate and the hospitalisation rate, how many people we can keep out of hospital, and we will continue to monitor that leading up to the 70% figure. But as I said, we're doing incredibly well in the pace of our vaccination program. We had a slight slowing down this week. We believe because there's a bit of a gap between first dose and second dose, but we don't want anyone who hasn't been vaccinated yet to sit at home. We want you to come out, get vaccinated, do your bit for yourself, your family, and also remember that people might say, well, if you're not vaccinated, that's on you, and you might get sick. Well, no, unvaccinated people spread the disease much more readily. So if you're in a venue or if you're somewhere and there's unvaccinated people, you have more chance of getting the disease from them because they don't have that protection. So it is about thinking about the greater good as well, not just yourself. It's about thinking about your loved ones and your community.
Premier, you just made some strong statements about hospitality and that 70% imposition rule, and people can't go into those sorts of venues without being double vaxxed. Last week you said that order would be sometimes up to the business themselves rather than the state, but now you're very clear. There will be a health order to clarify that. Can you give us more information on that?
I didn't.
What will happen to restaurants and pubs? And we're seeing more of them who say they don't care, they will accept anybody unvaccinated as well as vaccinated.
Firstly, I didn't actually say that. What I said was at 80%, we're still looking at what is going to happen at 80%. But at 70%, we've been extremely clear and extremely black and white. There is no doubt as to what we said when we announced the roadmap. At 70%, if you're not vaccinated, there will be a health order. It will be the law that if you're not vaccinated, you can't attend those venues that are on our roadmap. You can't go into a hospitality venue. You can't go to ticketed events unless you are vaccinated. We made that very clear for 70% double dose. What I also said that day is that we're considering what 80% double dose looks like. Because again, what we need to consider is not only what the unvaccinated population could do to our hospital system, but the rate at which disease can still spread if too many people are unvaccinated. So let me again be very clear, at 70% double dose, it is a requirement that you are only allowed to enter any hospitality venue or any of those or receive services like hairdressers, etc., if you are double dosed. And that will be in law, it'll be in a health order, and there'll be no grey. It's very black and white.
So the business will be prosecuted. Just can I follow that, Premier?
Yes, we've already made that very clear that both staff at 70% double dose, all staff and all patrons will need to be fully vaccinated because we can't afford to have 30%. Imagine if 30% of our adult population all got the virus, a large proportion got ill, our hospital system would be overrun. We've made this very, very clear from the outset. This is consistent with the Doherty plan. It's consistent with the national plan. and it's consistent with what we've been saying. It's 70% double dose. There is no question. Unvaccinated people will not be able to utilise hospitality venues. They won't be allowed into particular events. They won't be allowed into particular indoor settings. They are the rules based on health advice, based on the national plan. And what our government is currently doing is working towards what 80% looks like. But even at 80%, the kind of questions that government will need to answer is, do you want, say for example, 100% of a venue to be occupied? If you do, that's great, but that means probably you'll need vaccination. Although, if you want 75% of a venue occupied, you might then be able to rely on social distancing and other measures. These are the kind of issues we need to think about at 80%. That has not yet been made public because we're still working on it. But 70%...
2 weeks, Premier, between the 70 and the 80%.
Would the state government be providing some level of guidance? Because a number of business owners, say in hospitality, are saying we're going to be navigating a legal minefield based on who's had the vaccination and who hasn't. Will there be some guidance?
Well, I've given pretty much good guidance today, and we will have the vaccination passport in New South Wales when we hit 70% double dose. So you'll be able to check into a venue with your QR code and also see whether or not you're vaccinated. And that's really, really important. All of us are looking forward to that time, but all of us are in uncharted territory. The government, we will need to seek legal advice ourselves. This is uncharted territory, but what we're doing is providing as much certainty as possible, as much certainty as we know exists at 70% double dose. And in good time, with plenty of notice, we will be giving everybody a roadmap as to what 80% double dose looks like.
Deadlines are looming for those vaccine mandates.
Have you had so did you release the 70% roadmap without legal advice?
No, the 70%, when you're in a pandemic, governments are able to make plans, able to make decisions, introduce health orders.
But have you had legal advice on the 70% plan?
We receive advice from a myriad of sources every step of the way. And what people choose to do individually is on them in terms of legal issues. But I will say this, our job is to provide certainty and to provide safety to the community, but also to see both patrons enjoying their freedom and businesses up and running as much as possible.
Sorry, Premier, have you had legal advice on the 70%?
Well, the legal advice was, of course, dealt with through also the National Cabinet system, because we're following the Doherty plan. We're following what National Cabinet signed off on. What the issues we're facing?
Why can't we follow the 80% legal advice that's been given to Doherty?
Because the 80% roadmap for New South Wales we will be the first state to hit the 80% double digit, and the Doherty plan is very clear in saying that what you can do at 80% and beyond depends very much on what the cases are doing and what is happening in the community at that time. So the closer we get to that time, we will be able to release that information, that plan, and to provide absolute certainty. But the national plan is there, that gives good guidance, but there are some issues which will be challenging for us to face beyond 80%, and that's why we need to make sure the transition is smooth, and that's why my best advice to everybody is get vaccinated. But what I can tell you is that at 80% double dose, international travel, welcoming home Australians is definitely on the cards, definitely something New South Wales will be pursuing. But we do have to go through a number of issues that are outstanding in terms of what the broader community can do. And remember, we will be the state that opens up or hits that 80% double dose first, in all likelihood. And therefore, it means a challenging time for us, because I'm sure other states can't put their borders down until they all hit 80%. So we're going through all those issues. These are challenging times, and what we can do is provide as much certainty as early on as possible.
Premier, to confirm, can I please just confirm at 70%, Premier, will it be an offence for a business to accept a customer who is not vaccinated, and if so, what will the punishment be?
Well, we're going through the compliance issues right now. So obviously there is an onus on you as the individual to be vaccinated. There's also an onus, and it will depend on the size of the business. We know that many small businesses are doing it tough. So we are going through that compliance regime right now. to give enough notice to businesses before they open. But it's, there's individual responsibility involved, as well as for larger institutions, for workplaces, for major events. You would expect some level of business involvement in that. But obviously for smaller sized businesses, that is onerous. So we're looking at that whole regime, and we'll make that public to give every business time. But it's no different to how at the moment we'd been managing, or before the Delta outbreak, we'd been managing the service where QR codes had to be imposed, and business worked so closely with government. We're deeply grateful for that. There was cooperation, and that cooperation I know will continue. And I also know that business and community, we're working together, and all of us want to see this process as easy as possible. But there is a compliance regime that we're going through now, making sure that we haven't left any issues unresolved well ahead of us opening up. When I say well ahead, weeks ahead of us opening up, we'll be able to provide that certainty, what the penalties are if either an individual purposefully defies the orders or a business doesn't take enough responsibility. But again, we appreciate that many small businesses have been hanging on by a thread, and it's got to be a good balance between ensuring everybody is doing the right thing, but also making sure that people don't cut corners, because it only takes a handful of businesses or a handful of individuals to do the wrong thing, and then it puts our plans in jeopardy.
And Premier, the vaccine mandate deadline is looming for health workers and teachers. Will health workers and teachers who refuse the jab lose their jobs?
Look, they're issues which both the Health Minister and Department, and also the Education Minister and Department are going through. But we've made very clear that if you're providing service in a health facility, in a health setting, you need to be by a certain time vaccinated. And again, they're not the easiest issues, and we're working through those issues as we speak. And similarly, I think everybody appreciates that if you're teaching, have direct contact with children, and also with adults who are dropping off children, that it's in your best interest and the interests of the children you're taking care of to be vaccinated.
At this stage, are we at a point where we don't know what happens if we reach that step for when teachers and when health staff have to be vaccinated? Are you saying that at the moment there's no consequence in place for when we hit that day and people don't have
Well, obviously we've already made very clear that it's 70% double dose, and that's why schools going back is incremental, and obviously health is working through all those issues, and if there's any further advice we need to provide on that, we will. But I understand in terms of health workers, it's in the high 80s already, like in terms of full vaccination, it's nearly 90%.
Are there any plans in place at the moment? It's 1 in 6 health workers, I understand, New South Wales health staff at the moment that haven't had their first dose, and we are very close to that first dose deadline. Is there a plan in place to fill those job shortages, seeing as we are coming up to a peak of the need for the health system? Yeah,
look, I don't know where those figures came from, but I will say this, that our health systems and education systems are very large, and they're always welcoming new people. So obviously as a new person joins the health system as a worker, they will be offered the vaccine. And so sometimes those rates could be a reflection of new people coming into the system. But generally speaking, I understand that vaccination rates are close to 90% for people that work in the health system, and obviously we want to get that up as close to 100% as possible by the required date. And those ongoing discussions will take place, and we'll advise the community if there's any challenges we foresee.
Dr. Shanch, can we just ask quickly, could you give us an update, Dr. Shanch, on...
Still to get their single dose, and are you concerned that this will take people out of the health system as workers?
Look, I'm going to take a more positive spin on it. I think that we've got a real push to get the last of our healthcare workers vaccinated. I think healthcare workers care about their patients. I'm just trying to find the data point, but I think it's around 88% first dose. I'll just need to confirm that. Yes, 88% of all New South Wales health staff have received the first dose, and 80% are fully vaccinated. So we know that 88% will convert to the second dose, because everyone who has the first dose will convert to a second dose. I'm really confident that healthcare workers will put the interest of their patients and the interest of their own health, and I'm very convinced we'll achieve very high vaccination coverage. I think our health staff are seeing the consequences day in, day out of COVID infection. They're seeing patients in ICU, they're hearing the stories. I would be very surprised if we would have much hesitancy in our healthcare workers. We'll obviously we have a process, we have other mandatory vaccinations in health, and we have processes where we work through with individuals. They may be needing special counselling, they may need their special circumstances addressed, there may need to be liaison with their healthcare provider. I mean, health always takes a compassionate, thoughtful approach because we know that education and information is the best way to convert people that may have those questions. But I'm very confident that the vast majority of healthcare staff will be vaccinated.
A lot of those health staff had their first jabs back earlier in the year, and there's a lot of concern that the effectiveness of those jabs were running out now. Have you yet laid down a plan for those booster shots, particularly for our frontline workers?
Look, a group that I talk about regularly called ATAGI, and that's the Australian Technical Advisory Group on Immunisation, and that provides advice to the Commonwealth Government and all the states on guidance about when boosters are necessary. It provided advice to the government in relation to the 12 to 15-year-olds. That group is incredibly active. It meets many days a week, it reviews the international evidence, and it will provide that advice. But at this point in time, our focus is getting those first doses in and those second doses. And can I just stress, I just want to acknowledge the work of our pharmacists and our GPs. Currently, the supply for the state is static in these next couple of weeks, so you will see a little bit of a lower doses than we did previously when we received that boost from the Commonwealth Government. But we know that the supplies through general practice and pharmacy, particularly with the Moderna, later towards next week. Our pharmacies, I believe about 500 pharmacies in the state will be getting Moderna, and that will be followed up by another set of pharmacies. Please look around for an appointment, get an appointment. The vaccine access should really improve, and I really just express my gratitude for GPs who are just working with us to get every dose into arms as soon as possible. Remember, you need that 2 to 3 weeks for that vaccine effect, and so the sooner we get those jabs in, the sooner we've all got that little bit of protection.
Dr. Chan, you mentioned the positive case in Young. Dr. Chan, you mentioned the positive case in Young that's been identified. Word is spreading like wildfire in Young right now that the town is going to be locked down. Can you confirm whether that is happening or not?
So what we do is we provide advice. We're just seeking some additional advice. As I announced that we'd seen sewage detections in Young, and we found a case which actually was from another local health district. When that case was interviewed, that person had actually been in a number of other places. We're putting that together. We provide our advice to government, and then obviously there's a process where if there are cases in towns, we advise certain action. So at the moment we're just pulling those pieces together. The exposure sites, it's important that everyone in Young follows that public health advice which will be issued locally. I know there are a number of venues, and further urgent testing is being undertaken.
There's been a stabilisation in the hotspot areas. Do you put this down to improved vaccine rates or the restrictions that are in place?
I think I've all along said that there's no silver bullet, although vaccines are very effective. What I'm indicating is that the actions taken are a comprehensive package, and they were a range of restrictions. They were pushing a lot of vaccine into particularly the younger age groups in that population, and lifting vaccine coverage. So it's going to be for other commentators to pull out and tease apart. But like most things in public health, you need a combination of strategies. But going forward, we're going to need that mix of, COVID-safe practices, extremely high rates of vaccination. And can I just echo the words of the Premier? I actually want New South Wales to be the most highly vaccinated. We're pushing towards the Canberra level, so ACT's got the highest level in terms of their second dose. Let's get up there. And some of the age cohorts I really want to push up. We're still seeing elderly people who are not protected. We've still got 70 plus age group, 50 plus age group. We've still got people that really do need to get vaccinated urgently, as well as our younger age groups who have not previously had such free access to vaccine.
That age group, Dr. Chan, is it worth opening up the vaccines and allowing more choice now to scrap this idea? I know ATAGI again made the decision, but would you recommend that finally we'll let anybody choose what vaccine they need?
Look, I think ATAGI has guided us very well through this, and I really defer to the advice of ATAGI. At the moment, we are doing a mammoth push. Vaccine will become increasingly available, and we'll look to ATAGI's advice around a variety of things that are being speculated about: the need for boosters, the Delta-specific vaccines, vaccinations for children. This will be an evolving information about and guidance around vaccines, and I think we just need to get used to the fact that vaccination and regular vaccination will be part of our future of striking that balance of living as safely as we can, knowing that we have to function as a society and we have to manage health and well-being in keeping COVID.
At 70%, would you still want to see the 5 kilometre restriction, masks and working from home for people who are not vaccinated?
Health has participated in the roadmap, and we've issued the sort of guidance that we suggest. Obviously, in that roadmap, there was also a note that depending on where communities might be, where the community cases might be occurring, there might be some additional public health measures we need to put in place. Now, that public health measure could be targeted vaccination. You know, we know a particular area or a particular vulnerable community is under-vaccinated. We might need to go in there and vaccinate them. It might be a range of other restrictions or other elements to the response. So again, we'll be learning how to get the virus suppressed as low as we can. And the thing the community can do is continue to follow those COVID safe practices and get vaccinated.
With the people in older cohorts,
Sorry.
just following up on what you said about older cohorts, still you believe are not where they're needed with vaccination rates, and Premier, if you could speak to this as well. I think this is mostly to you. Other states are opening up Pfizer to those older cohorts, particularly states where the vaccine is lagging a little bit, and of course the target advice is what it is. But Premier, are you open to doing that to get those vaccine rates up, and is there the supply available for that to be an option?
Can I just answer that question before deferring to the Premier? The vaccination coverage in a lot of those cohorts for the first dose is actually quite good. There's a little bit of room to move in terms of first dose, but there's the second dose we need to push up to get to that 95% universally in those age cohorts. At the moment, we still don't have totally unconstrained Pfizer access, and at the moment we're prioritising the groups that have not had vaccination whilst encouraging all of the older age groups to take available vaccines. And can I just say, the AstraZeneca vaccine is actually holding up very well. It's a vaccine I've had, the Premier's had, my mother-in-law had, my son had, my husband's had, and I think we shouldn't, you know, at the moment the key message is we are very privileged to have very effective vaccines, and we're not at an appropriate phase where we should be picking and choosing. The vaccine, we should be taking the opportunity to get vaccinated with whatever effective vaccine we've got available.
Premier, did you want to?
Thank you. Just further to that, if you consider the rate of COVID, of the virus in particular areas, if it's a choice between getting the vaccine or getting COVID, I think the answer is pretty obvious. To protect ourselves, our loved ones, the community, all of us should get vaccinated. The ATAGI advice is very clear. Both vaccines are extremely safe. I've had the AstraZeneca, and in a pandemic, we don't always have choices. What we do know is that we have 2 good vaccines that are holding up extremely well. And unless someone has underlying conditions, in the main, fully vaccinated people are protected against Delta variant, which is a positive. There's a couple of silver linings that we've learned in the last couple of months. That is one of them. So I urge everybody over a particular age, and in over 70 age group, I think we've got 90% vaccinated, which is very good. But whoever isn't vaccinated when we start opening up is vulnerable. And all of us are vulnerable, frankly, because as we know, people who aren't vaccinated spread the disease more quickly. And for my part, even though I'm fully vaccinated, my parents are, I'll still be careful around my parents, because it doesn't mean you can't get the disease or pass it on. But if you're with people that aren't vaccinated, there's a higher likelihood of you getting the disease and passing it on, sometimes without knowing. So these are all the challenging issues all of us have to face moving forward. Our job as a government, and Dr. Chan's job as the Public Health Chief Medical Officer, is to give us the best advice, and for me to give the people the best advice, our citizens the best advice on what will keep us as free and as safe as possible once we get to those high vaccination rates. And if you do have access to a vaccine and you have any medical concerns and you've checked those out, please get vaccinated.
Dr. Chan,
Dr. Chan, yeah.
2 new cases in Albury. Can you confirm if that community will go into lockdown tonight?
No, I can't confirm any of that. What happens is, as Dr. Chant said, health collates the advice and gives us their advice. So it's up to health to tell government what to do in relation to those matters.
One case is the tipping point for lockdown, we were told.
But I've just heard that from you. I have to hear it from health, with all due respect.
Dr. Chant, can we just ask for an update on Newmarch House? Dr. Chant, what is the situation there?
So, as you're aware, there was a health care provider who entered Newmarch House and was positive. That person was fully vaccinated. So again, it does highlight the fact that we can't be complacent. Appropriate public health action has taken place. The healthcare provider did have contact with a small number of patients. I understand the testing was facilitated last night, close contacts identified and rapid action put in place. I haven't got an update yet on the results of those testing, but obviously in due course. And first of all, we would communicate to the families of the loved ones who have got residents in those facilities.
Dr. Chant, we've just had a push today about getting pregnant women and breastfeeding women vaccinated. We just heard from people today saying that it's actually difficult to get in here at Kudos because mothers with babies in arms aren't actually allowed to take them in by themselves. Is there enough information as to where the best place for a woman with a baby in arms to get vaccinated is? Because obviously you can't come here.
Look, we'll follow that up and look at safe procedures. I mean, obviously there's issues that we need to make sure that patients are safe. So look, I'll follow up those issues. But your general practitioner will have access to vaccinations. Pharmacies will have access to vaccines. So often pregnant women will have had a good relationship with their general practitioner, and increasingly GPs will have access. So your GP may not have previously been providing Pfizer vaccine, but now they will be providing that. So please just recheck. My message is that the landscape keeps changing, and people may have had an experience where they've reached out to a healthcare practitioner and at that point they could not get vaccinated. But the situation in terms of supply and who's got access to the vaccine has changed significantly. So please go to the website and find a vaccine and get a vaccine as soon as possible.
Premier, just fine. Premier, just...
Thank you, everyone. Dr. Chant, of what she would like to see about the targeted vaccination in areas for
I'm sorry, I can't hear your
people.
question.
Sorry. We've heard from Dr. Chan about her view of what should happen at 70%. Would you still want to keep the 5-kilometre radius, the masks, the working from home for people at 70%? Would that be further incentive for them to get vaccinated?
I think we've already said what we have on the roadmap. Health gives us input and advice into the roadmap, and we've made very clear what you can do when you're completely vaccinated, and any outstanding issues will be dealt with before that time.
Premier, have you been named as a person of interest by the ICAC?
Nope.
Thanks, everyone. Can I ask?
That was the last question. Yeah.
What's the health advice preventing you from changing the restrictions on outdoor exercise in the 12 LGAs?
I'm sorry?
What is the health advice preventing you from changing the outdoor restrictions to the people in the 12 LGAs?
I'll ask the health expert.
Currently, people in the LGAs of concern can actually exercise outside, and we've also got ability to go out for recreation as well. We are looking, as I've indicated, as we see those case numbers come down, what additional restrictions can be eased, and obviously we are seeing the spread of the disease into other areas. So we're seeing impacts in areas like Maroubra, Waterloo, Redfern, and so we now need to look moving forward at what are the range of public health restrictions we need to have applied as we move towards that 70% roadmap. So we keep everything under review, but the key message that I would like the communities of southwestern Sydney and Western Sydney to take away from this is that you have done so well. You have achieved really high rates of vaccination. You need to get that second dose vaccination coverage up and even drive that first dose higher. I thank you for your forbearance, but we are not out of the woods yet. There is pleasing signs in a couple of those LGAs that we're seeing that turn, but we really need to drive those case numbers down. That will be the best things for your communities, for your family, for your loved ones. So please, whilst there is the removal of the curfew, we do need to make sure that we go about our lives in the most COVID safe way so we can suppress the disease transmission in those areas.